Hi, my name is Karen Battaglia. I'm a registered nurse and community educator at Carroll Hospital Center. Congratulations on the upcoming arrival of your baby. This video will outline the steps of a planned cesarean section. If you have any questions about the procedure, please contact your obstetrician or the family birthplace. Before arriving at the family birthplace for your surgery, please prepare in the following ways. Do not eat or drink anything after midnight before your surgery. You'll want to shower with some antibacterial soap in the morning before your surgery. And please do not shave the abdomen or pubic area, as this may leave small cuts that could be sites for infection. Nurses at the family birthplace have clippers that they can use to clean up the area as necessary. You'll need to arrive at the hospital about 2 hours before your scheduled C-section. In addition to bringing your personal belongings, you'll also want to bring with you a list of any medications that you're taking. This would include prescribed medications, over-the-counter medications, vitamins, or herbal remedies. On this list, you'll want to include the dosage that you take, how often you take the medication, and the reasons that you are taking the medication. Please be sure to let your nurse and doctor know about any chronic illnesses that you may have, such as asthma, diabetes, or high blood pressure. When you arrive at the family birthplace, you'll be brought to our triage area where you'll be admitted. There you'll be asked to remove your clothing and put on a hospital gown with the opening in the back. We'll ask you to remove any and all jewelry that you have, including piercings, and we'll ask you to give us a urine specimen. The nurse will take your vital signs, including temperature, pulse, respirations, and blood pressure. The nurse will also listen to your heart and lungs. Next, we'll place the external fetal heart monitor on for a short time. The nurse will ask you several questions as a part of our registration process, and then we'll get your IV started. At that time, the nurse will also obtain a few tubes of blood that will be sent to the lab. Before the surgery, the nurse will inspect the abdomen where the incision is to be made. If the area needs any cleaning up, the nurse will do so with clippers. It will also be cleaned with a sage wipe, which will be used to reduce infection at the incision site. Your obstetrician will meet with you to explain the procedure and will have you sign a surgical consent form. An anesthesiologist will also meet with you to explain the anesthesia and will have you sign an anesthesia consent form. The nurse may give you a liquid medication called polycitra to neutralize the acids in your stomach and to prevent nausea and vomiting during surgery. One support person will be allowed in the operating room during the surgery. That support person will be given protective clothing to wear over their clothes. They'll also be asked to wear a hat, shoe covers, and everyone in the OR will wear a mask. The support person will be asked to wait in the waiting area until the surgery is ready to begin. Once in the operating room, you'll be seated on the operating table and the anesthesiologist will be there ready to administer anesthesia. Your nurse will be there to support you and explain everything that is going on. Monitors will be placed on your chest to monitor your heart rate. A blood pressure cuff will be placed on your arm. A pulse oximeter will be placed on your finger to measure the amount of oxygen in your blood. You'll be asked to put your chin to your chest and push your back out in the shape of a C and remain very still during the procedure. Your back will be cleaned with a cold, wet solution, and then you will be given a numbing medication. You may feel a pinch and a burn. Then you will be given a second numbing medication to numb the skin a little bit deeper. After that, you will feel some pushing on your back until the doctor gets to the correct place and the medicine is administered. Once the medication is injected, the needle comes out and the anesthetic is complete. Your feet will begin to feel warm and tingly, and the nurse will quickly lie you down and place a blanket under your right hip so you are not lying flat on your back. Your arms will be placed on boards out to your sides so you do not place them in the sterile field. Next, a catheter will be placed in your bladder to keep it empty. You should not feel this insertion since you have already been administered the anesthetic. The sequential compression devices are applied to your legs with Velcro. They will be hooked up to a machine that will pump air through the SCDs and keep the blood circulating in your legs to prevent the blood clots. The catheter and the SCDs will stay in place until you get out of bed, approximately 12 hours after surgery. A drape will be placed in front of you so you do not see the surgery. Your abdomen will be cleaned with a sterile solution for the surgery. Your OB and the house doctor will scrub in and gown for surgery. A sterile drape will be placed over your abdomen from the waist down. Your support person will be brought into the room and seated at the head of the bed with you. Anesthesiologists will also be there as well to care for you during the procedure. A timeout will be called prior to the starting of the surgery by the OR nurse. This is part of the patient safety initiative in which the patient is identified and the surgery to be performed. All of the members of the OR team will be present at this time. The obstetrician, the hospitalist who is also an obstetrician, a surgical technician who assists in the procedure, an OR nurse, a baby nurse, and a pediatrician. Your OB will test the skin to ensure that you are comfortable and that it's okay to begin the surgery. Typically, a bikini incision is made horizontally across the abdomen, approximately 4 inches in length. The skin will be cut. The next layer is a fatty layer. The muscles will be separated manually. Then an incision is made on the uterus. Your water is broken, and the doctor reaches in and guides the baby out. You will feel tugging and pulling at this point, but no pain. The umbilical cord will be clamped and cut, and at this time you will be given an antibiotic through IV. The baby will be handed over to the baby nurse and placed under the radiant warmer, where the pediatrician will assess and treat the baby as needed. The placenta is delivered and the uterus is inspected and closed. The skin will then be closed using staples or sutures, and a bandage will be applied. For your recovery, you will be transferred to a bed and transported to the recovery area where you will be monitored for a few hours. Your support person and baby will stay with you unless the baby has special needs, and then would be taken to the special care nursery. Visitors will be able to visit once you have left the recovery area. While you are in recovery, the nurse will closely monitor your vital signs, your vaginal bleeding, and your fundus for firmness, which is the top of your uterus, which should stay firm at all times. A PCA pump will be put in place for your pain. Typically, morphine is used. You will be in control of your pain medication, and you'll push a button to administer the medication whenever you're feeling any pain. Once you are able to wiggle your toes and bend your knees, and all of your vital signs are stable, you and your baby will be taken to a suite at the family birthplace for the remainder of your stay. A cesarean section is major surgery and requires weeks of recovery time. Your activity will be limited during this time, and your obstetrician will provide you with specific guidelines to follow for a safe recovery. We look forward to helping you welcome your new member of the family. If you have any questions about the procedure, please call your obstetrician or the family birthplace at 410-871-6920. Thank you for choosing Carroll Hospital Center for your delivery.